Well, spring, as we have said, has officially sprung for many folks, and so have their allergies, whether it's pollen outside or something inside. The more you know about what triggers the attacks, the better your chances of getting proper treatment. Dr. Scott Ackerman is one of the First Coast leading doctors. He is here today to talk about the ABCs of allergies. Welcome, Dr. Ackerman.
Thank you, Casey.
They are awful. They are so bad this year. And everybody that I've talked to have noticed it one way or another, just whether it's the sneezing or the eyes are watering or the itching, or like I was talking at the top of the show, sometimes I'll sneeze and I'll just get a quick headache as a result of what I think is allergies. So let's break this all down. Okay, first of all, what is an allergic reaction? Kind of dive into what that actually means.
Okay, so allergies are an abnormal response of our immune system to substances that would normally be harmless. And when we're exposed to these substances, we call them triggers, then our body produces antibodies to these triggers. And these antibodies attach to certain cells in our body called mast cells, M-A-S-T, mast cells, which you don't need to remember that, but what you need to remember is that these mast cells release histamine. And you've heard of antihistamine.
Sure,
it's a drug we take to minimize the symptoms of allergies. But so the histamine causes a histaminic response. And this histaminic response is what causes the symptoms of allergies: runny nose, watery eyes, redness and swelling around the eyes. In severe allergies, you can get some swelling of the throat and the tongue and make it difficult to breathe. So you have to be careful. With some allergies, can really be life-threatening.
Yeah, and sometimes they just are really annoying. There's
Yeah,
nothing
most
you
of the
can
time,
really
they're
just,
annoying.
you know, and you just can't do anything about it. What are some of the common triggers that you see out there? I think the yellow dusting on the cars is one big sign, right? That's the pollen.
Right, that's pollen. And so, you know, I hear this from patients a lot every year this time of year. This is the worst year ever for allergies. Well, it's because we just finished a long winter, and not that long here in Jacksonville, but we finished winter, and there hasn't been a whole lot of pollen and that sort of thing. So all of a sudden it hits, and people think it's it's very bad, but pollen is a big thing that a lot of people are allergic to, and not just the yellow stuff that you see, but there's also pollens in the air that you can't see. There's a great little there's some great little apps now on phones that'll tell you for your area what the allergy level is, what the pollen level is, so you can use that as a tool to try to minimize your exposure to pollen.
Stay indoors.
Right, that's all you really can do.
Right.
Wear a mask, I guess, but stay indoors. But other things besides pollen, pollen's a big one. Animal dander. Now, we all hear about animal dander, and I asked my staff the other day, do you know what animal dander is? We talk about it a lot, but no one really knows what it is.
Yeah, what is it?
Right, so right, I think it's like the shedding of the animal.
Oh, okay.
So it is the shedding, but it's not the hair that sheds. It's like skin and dandruff from an animal, like we have dried skin that comes off and dandruff. That stuff that comes off of animals is called dander. Also in the house you have dust, and in the dust there's little mites, and those dust mites is an allergen. It'll cause a trigger. And the dust, by the way, is really people dander in many ways. It's a lot of the stuff that sloughs off from our skin. And so mites will grow in there. Insect stings and insect bites can be an allergen. So can mold. Certain foods. People who are allergic to nuts, we hear about tree nuts allergies, and also peanut allergies, dairy products.
It seems like
allergies.
There's just a lot of things to really narrow down. My question is, can you test to find out exactly what you're allergic to, since there's just so many
So what happens is people
triggers?
have these allergic reactions, don't know what it is, so they see their doctor, and the doctor may do the test himself or herself if it's a primary care physician. Sometimes if it's a tough diagnosis, they may send the patient to an allergist. These are doctors that specialize in evaluating allergic reactions and treating them. And many people don't know what they're allergic to, so we do certain tests. The most common test is a scratch test or a prick test, where the allergen, the potential allergen, is just in very small amounts, is scraped on the skin, and they scrape the skin with pollen, and they do it with some sort of animal dander and whatever, and in different areas, and keep track of what was scraped where, and then look a few days later at what area has the worst reaction. And where the worst reaction is, that's the thing that you might be allergic to.
Okay.
But some people can't tolerate that, and if you're very, very sensitive to certain substances and may have a life-threatening allergic reaction, we could do blood tests. They're much more difficult, much more expensive, but you take blood, and you look at the blood, and you look for certain immunoglobulins within the blood to determine what kind of allergic reaction that the patient might have.
And that'll help you be able to then stay away from or try to avoid, I guess, those triggers if you know what is causing it. But can you also do something else? Is there something that we can do to reduce the symptoms, I guess, of
So people who have allergies, they have a very sensitive and very protective immune system. and you really can't do a whole lot about that. Allergies also sometimes wax and wane during your lifetime. A lot of times you're allergic to certain things as a child. As you get older and you get exposed to those things more, you become accustomed to it and you don't have quite the allergic reaction. And conversely, some people develop allergies through their lifetime. They're not allergic to certain perfumes, but then later on in life, they may be allergic to those perfumes. But what can you do? You could change your lifestyle, you could change your environment a certain bit to avoid allergies. We talked about the pollen before and pollen alerts, and you were joking and saying, well, what are you gonna do, just stay inside? Well, yeah, that's what we recommend, is avoid being outside when the pollen counts are high. In order to minimize dust mites and those sort of things in your house, maybe replace your carpet with wood and tile, that sort of thing. Wash your sheets and towels often to make sure that there's no allergens in them as well.
I got to clean my house? Is that what
yeah.
I know.
Or have someone clean it for you, because you cleaning it, you'll be exposed to all those allergens. Get someone else to be exposed to the allergens.
It is so true. When I dust and and I've got all the critters in my house. I mean, literally. I mean, it's like my nose is running, my eyes, and I'm trying to reduce the allergens in the house, but sometimes it just seems like I'm creating a dust storm. Anyway, I really do try to clean my house, though, just FYI. Okay, thank you, Dr. Ackerman.
Thank you, Casey.
I appreciate you being here as always, and thanks for sponsoring the segment. Listen, Dr. Ackerman joins us every Friday. For questions regarding today's topic or anything else that you might have on your mind, no matter what it is, just visit firstcoastoncology.com. You can confidentially submit your questions to Ask the Doctor.